Yes, yes.
Can we start, President?
Okay, please do.
Right. A very good evening to everyone. We have just seen the end of the Utsav or the Tika Utsav, which was on a clarion call of our Prime Minister from 11th to 14th of April. PhD Chamber has been continuously working during these days to spread the message of Tika Utsav across the country, right from our eastern borders to the southern, to the western, right up to the northern frontiers of Jammu and Kashmir. This is yet another initiative keeping up the momentum for the Tika Utsav in these, I would say, ghastly COVID times. We've never seen times like these ever before. And this wave seems to be far more aggressive than the last one. I'd like to welcome our keynote speakers, Professor N.K. Congoley, former Director General of Indian Medical Council of Research. Sir, it's a privilege to have you with us and have you share with us your knowledge and your inputs during these difficult times. We are joined by Dr. Tika Utsav, Chief Medical Officer of Cghs, Ministry of Health and Family Welfare, Government of India. Thank you, Dr. Utsav. It's a great privilege to have you with us this evening. And we would love to know as to what's happening back at the Cghs and other frontiers with the Ministry of Health and Family Welfare is tackling with during these COVID times. I'd like to especially thank our President for joining us this evening and sparing his valuable time with us for this particular important initiative. We are also now joined by Professor Arvind Kumar, co-chair of our...
We've lost your voice, Vivekji.
Vivek, you are not audible. The networks are also COVID affected.
So may I request the President, Mr. Sanjay Agarwal ji, to kindly give his presidential and welcome remarks. Over to you, sir.
Thank you, ASG Vivek. On behalf of the PhD Chamber, I would like to give a hearty welcome to our keynote speakers, Dr. Tika Utsav, Chief Medical Officer, Cghs, Ministry of Health and Family Welfare, and Professor N.K. Ganguly, former Director General, Indian Medical Council of Research, for today's webinar on the importance of Tika Utsav, the COVID vaccination drive, and the clarion call of our Prime Minister.
So Dr. Subramanian has also joined.
Yeah, I can see. Yeah, welcome, Dr. Subra. So, thank you so much, sir, for our guests for having spared your valuable time. I would also like to acknowledge the presence of the Chair of the Health Committee, Dr. N. Subra, and Co-Chair, Dr. Arvind Kumar, as also the Secretary General of the PhD Chamber, Mr. Saurabh Sanyal, and of course our ASG, Vivek Sehgal. A very good evening to you all. This unfortunate times, one feels a bit awkward saying these terms like good evening or using the term happy when the whole nation, it seems, is in the throes of this pandemic, which has certainly seemed to have gone crazy. And the fact of the matter is that all the statisticians and epidemiologists and all these predictions ultimately can at best be predictions, and end of the day, they can warn us and they can tell us that what sort of precautions or what sort of steps that we need to take to make sure that we don't end up in a difficult situation as our nation is facing right now. We had actually been having quite a smooth run in the past, and our earlier peak seems to have like a plateau today in terms of the numbers that we are seeing today. 2 lakh plus of daily infection number is something that is totally beyond the pale of what we experienced or saw earlier. So of course, nobody can say that there is any one panacea to all this issues that pandemic has caused. But I think it has to be a COVID vaccination has to undeniably play a very major role. There cannot be any watering down of the importance of the vaccine. Of course, in addition, one cannot at all ignore social distancing or mask or wearing the mask or taking other precautions in terms of hygiene. And of course, the testing regime and the tracing regime is also all going to be as strongly needed in our today's context as it much more than probably it was realized in the past. So all these things taken together, testing, quarantining, tracing, then social distancing, wearing of masks, and all said and done, then on top of that, to get the vaccination done to the maximum percentage of population at the fastest clip possible is the need of the hour, and that is what the Prime Minister has also stressed on, and that is what we all need to understand, that there is no time or room for any vaccine hesitancy. Whether we are offered vaccine A or vaccine B, in any case, we have to go ahead and get vaccinated as long as we are falling in the right segment or bracket that the government is allowing at the moment of time. We are, of course, with the sort of spread, I think, that is happening, there has been a widespread feeling that in the trade industry also, that we should. I'd like to welcome Dr. Arvind Kumar also, who's also going to be our keynote speaker. Welcome, Dr. Kumar. He is the chairman of Chest and Surgery and director for Institute of Robotic Surgery at Gangaram Hospital.
I'm at Medanta Hospital, sir.
Medanta, okay. So I'm sorry, I'm misinformed.
No issues, no issues, sir. Thank you so much.
Thank you. So I think what really is important now is for us to be having the maximum spread and distribution of vaccines as they are being made available. I think the government has taken a very welcome step, and I think an unprecedented step by allowing the import of vaccines which have already been approved by some of the major regulators in the world, including EU and US and Japan, for example. That should also help increase the availability of vaccines. But one more aspect that needs a lot of consideration, of course, is the vaccine hesitancy, which needs to be addressed across the segments, across economic segments, across social segments. People need to be fully made aware that they cannot wait and they cannot take the risk or play with their lives by not opting for the vaccine at the earliest moment that they are given the option to. The mortality rates, fatality rates, whatever we call them, they are on the rise. The positivity rates on testing is also again on the rise. And considering all these factors, we cannot stress the importance of vaccination. The Tika Utsav is exactly about this subject only. And that is why we are having such eminent speakers to talk to us, share their views, and to educate us on the importance and various aspects of COVID vaccine today. So I would not like to take too much time. further, I would just once again welcome all our speakers and request our ASG Vivek to take the proceedings further. Thank you.
Thank you very much, sir. Thank you for setting the outline and the background in which we are actually having this program, giving it a lot more relevance and um, providing better understanding to all of us here. I'm glad to welcome our chair of the Health Committee, Dr. Subramanian. Thank you very much, Dr. Subramanian. So nice of you to join in. While we speak, I think the most expensive time today is that of the doctors. So it's so kind of you and so kind of Professor Arvind to join us. Sir, thank you very much, Professor Arvind, for joining us. We're sorry about your change, which you probably made. I think we couldn't really catch that change.
Minor issues, sir. No issues.
Yeah. Thank you very much, sir, for joining us. May I request our chair, Dr. Subramanian, to kindly give his remarks.
Thank you, Mr. Sehgal, President Sanjay, Secretary General Saurabh, Dr. Arvind, Professor Ganguly, and Dr. Rathod, Dr. Katuj, Arvinder, and all our distinguished participants of this evening. You know, you and I feel so proud today to know that it's been 10 years since we got rid of polio in this country. I mean, most of us would not have believed it was possible. A disease which you know would thrive in overcrowded areas with low literacy, low sanitation, low education, low nutrition, and yet India as a nation overcame polio. We overcame polio, we overcame smallpox, purely because we all worked together on immunizing our people. Over the years, we all know of several conditions where immunization alone has made a difference. And today, we are also able to see the potential of the scientists around the world, scientists in our own country, our own entrepreneurs, our own researchers, and has brought to center stage what we are capable of. If you look at the polio vaccine, it took about 8 years from the time the trials started till it came into regular use. And today, yet, within a year, the entire world has managed to create not only one vaccine, but several vaccines based on several technology, which is going to help the situation better. We all know that even the most developed healthcare countries, the most affluent countries, the most well-planned countries with huge health budgets were brought to their knees by this unprecedented catastrophe. So you and I know very well that we had to be preemptive, we had to be proactive, and use the prevention as the only mode. Not because the disease won't happen to you if you had a vaccine. It may still happen. But it certainly will reduce your chances of having a disease. It will reduce the chances of the severity of the disease. It will reduce the chances of your transmitting the disease. Altogether, it makes you remain safe. It makes you safer for the others, and certainly reduces the likelihood of suffering. Because treating an established condition, which you and I are all struggling during this week, I can't tell you the amount of pressure, the amount of panic, and the amount of anxiety that I'm witnessing today everywhere around me. I know that if I'm getting a phone call from any friend of mine who has called me in the last 6 months, I know he's looking for a bed at this point in time. We can't afford to do that. We can't afford to live that life of fear. We cannot afford to live a life where we are depending on hospitals and intensive care units, etc. The country, the globe cannot afford it. But most importantly, we cannot have people suffering. So I think let's move on. As President Sanjay said extremely and very, very effectively communicated, there is completely no place whatsoever for any kind of vaccine hesitancy. Because whatever you and I may question about the percentages of security, percentage of safety, the percentage of side effects, the percentage of efficacy, the one thing I can tell you is you are going to be definitely better off with the vaccine than without it. And now that it is available, I would feel that all of us should feel not only grateful, we should also feel responsible enough, not only to take the vaccine, but take it forward to those and make sure that as partners with the government, assist the government in any form so that we can make the process easier. People like Professor Ganguly, who are such eminent scientists who have led research in this country for so many years. And many of us know that when the polio program started in India, it was Dr. Harshvardhan who took the lead in taking this program forward. So with people like him today in the lead, I have no doubts whatsoever. We will take this program to very, very successful conclusion and make sure that we protect more and more people every day. I'm really, really honored to be able to interact with such an eminent panel. I must thank the PhD Chamber for all the wonderful work that we've been doing during this period. And of course, I feel grateful to be a part of this wonderful program. Thank you all very much and welcome again.
Thank you. I'll join back. There was a storm here, so electricity has gone.
Sure, Professor Ganguly.
Thank you. Thank you so much, Dr. Subramanian, on re-emphasizing and also talking about the real importance of vaccination, despite all the fears and the talks or the media news which we keep listening to. And that's precisely one of the major reasons why we are having this kind of series of webinars on the Tika Karan and the Tika Utsav to be converted literally into a Mahotsav. I now request Professor Dr. Arvind Kumar from Medanta Hospital to kindly share his thoughts. Sir, I know you have been one of the foremost chest specialists who have been talking about the pollution in Delhi, how it's affecting the little ones, the old age people, and now this COVID attack. So could you share with us your thoughts on this fateful evening on the vaccine and why it is critical and if not essential to actually have this? Over to you, sir.
Distinguished dignitaries, a very warm good evening to every one of you. To save time, I would refrain from taking the names individually, but my very respectful, very warm greetings and namaskar to all of you, and my humble and sincere thanks and regards for this wonderful opportunity to be part of this elite panel as part of Chamber's attempt and efforts towards increasing the reach of the vaccination program. As was very elegantly mentioned by the Honorable President and also by Dr. Subramanian, we are at a very critical juncture in the fight against this pandemic, against this virus, which actually threatens the very existence of our race, not just the lifestyle or the normal life, but also our existence. The rate at which it is spreading today, you know, it's the numbers, 217,000 new cases detected in last 24 hours. And this is obviously not the real number. These are detected cases. The real numbers may be many times higher. And the peak is not yet to be seen because we have all kinds of activities which have happened. And as a doctor, my fear is that this number will continue to increase for at least a week or 10 days. Sadly, we have no specific medicine, unlike antibiotics, which can cure the bacterial infections. We do have some medicines, but they are not as effective as the antibiotics are for the bacterial infections. So in the light of that, preventing this disease from happening, or at least preventing the death and long-term disability from happening, is our immediate priority. And if there are three things which the vaccines have unambiguously given to us, there is no doubt anywhere in the world about these three things. These three things are: number one, it almost abolishes the mortality due to the disease. Number two, it almost takes away the need for ventilator, etc., etc. And number three, it almost abolishes the incidence of severe disease, which leads to long-term fibrosis, oxygen dependence, oxygen crippled, etc., etc. So death, disability, long-term disability, and ICU admissions and ventilators, if these three things are taken care of, there is a huge advantage that is coming from the vaccine. Because why are we all scared of corona today? We are all scared of corona because of the deaths it is causing and because of the long-term disability it is causing. If this was to be another common cold or flu-like symptom which will cause fever for 5 days, and we were sure that the worst scenario that we'll have is being off work with fever for 5 days, nothing more will happen, I don't think many in the country would have been concerned about it. But we are concerned because of the ICU admissions, severe disease, death, long-term disability. In terms of preventing the infections, the phase 3 trials had reported about 70% efficacy, which translates into that if 100 people are given the vaccine and 100 of them are exposed to the virus, 70 will not have the disease, 30 may still have the disease. But as I said, those 30 will have the mild disease. Now, what we are experiencing these days, there is quite a substantial number of doctors and other healthcare workers who had received both dosages of vaccines and are becoming RT-PCR positive these days. Fortunately, majority of them are having mild disease, but nonetheless, they are having a disease. If someone was to ask me the number, okay, can you give the number that is it 70%, is it 30% who are having out of the total vaccinated? I don't think I have the number, but I admit that there is a substantial number of healthcare workers who are having, but I don't know the denominator against which this number is being looked at. So whether it is 60% or 70% or 75%, but one thing is very clear, that this vaccine is giving us protection in terms of decreasing the infection risk, and definitely it is giving protection 100% in terms of death, disability, and ICU admission. With that background, why should anyone have doubts about taking the vaccine? Now, this is what foxes me, that when I present this kind of material, that these are the takeaways from the vaccine, where on earth is a scope for discussion whether to take it or not? Is there a choice? No. There are all gains and gains and gains, and there are no knives. There are no risks of the thing. Now, unfortunately, there has been a lot of talk about the side effects which were reported. So clotting and other things have been overplayed. Of course, there have been instances of clotting in the Western countries. There might have been few cases in our country also. But if you look at the numbers which have been vaccinated, we have 11 crore plus vaccination in our country till now. And I don't think we've had so many of these clotting issues there. But the number of people who have received protection is in millions. So therefore, there are huge gains which are coming from this vaccine, and there are very few minuses. Now, A lot of questions are asked about who should receive, who should not receive. The clear-cut contraindications today are pregnant women, lactating women who are breastfeeding their children, and children under the age of 18 years. These are the three categories which should not be given. You can add another fourth category, anybody who actually has an active COVID infection, active viral fever, or any other active infection right now going on in the body should also not be receiving. Other than that, somebody who has had COVID in the past, somebody who's a diabetic, hypertensive, heart disease, kidney disease, lung disease, liver disease, soft tissue disease, he's had cancer in the past, he's been on steroids, he has received cancer chemotherapy in the past. None of these is a contraindication, as also patients who are on blood thinners. A lot of times we ask that we get these calls, sir, the patient is on blood thinners, can he take? Answer is yes. But of course, we have to make a differentiation between blood thinners and anticoagulants. There is a group of medicines called anticoagulants, which are given to people who have got artificial heart valve. Those people have to take precautions. They have to first adjust their INR. But those who are on blood thinners, there is no contraindication. So to summarize, I would say that vaccine today is one of the most potent weapons that we have in our hand to prevent the spread of this dreaded virus. It has proved to be efficacious. It has proved to be 100% effective, or I should say almost 100% effective in preventing death, disability, and ICU admissions. It has negligible side effects. Therefore, it's the duty of each and every one of us to leave no stone unturned, to do everything that we can to reach out to people who have been accepted for the vaccination, which is as of today, anybody above the age of 45 years. But I would also use this platform to make a humble request to the health minister, considering the number of 18 to 45 age group people who are today getting the infections from this. I think there is an urgent need to postpone or to bring this limit to maybe 18 years. Of course, the availability of vaccine could be an issue, but subject to logistics, we should prepone that age bar and bring it to anybody who's above the age of 18 years. So I would conclude by making a request that I am leaving no stone unturned. Wherever I go, in any meeting, wherever I meet anybody, I tell them, please take vaccine and please encourage all those that you can to take vaccine. This is the best we can do at present to prevent the spread of this deadly virus. Thank you so much.
Thank you, Professor Arvind, so vehemently saying that, look, there are those three unambiguous, and I repeat the word unambiguous, just as you did, Professor Arvind, that three positive indications which are very truly coming out of that vaccination. So thank you very much for putting across the message very loud and clear without leaving any doubts. Time for me to welcome Dr. G.C. Khilnani. Thank you very much, sir, for joining us. It's a great pleasure to have eminent personalities like you, Professor Arvind. We have Dr. Subra, and of course, we have Professor Ganguly and Dr. Katoch already there. ICMR has always been at the helm of research, and I think there's a lot of research and groundwork which has gone into the vaccination across the globe. And who better than Professor Ganguly himself to actually guide us as to how this vaccination actually came about in 2 years, where a lot of people have doubts that whether it's a true vaccination, and how can you as an expert, give us details about this vaccination. Over to you, sir.
Thank you, Dr. Vivek. Actually, Dr. Arvind, in a very succinct way, has summarized the effect of the vaccine and where the vaccine works and where we need to still take precautions. So vaccine, I will start with this, that vaccine doesn't give you license to become unmasked. You need to mask even if you have received the vaccine, and you need to follow social distancing even if you have received vaccine. These two things, the messages I want to say clearly to everyone. Actually, our country did much better than many others by having some measured decisions, which ultimately have paved way that we are able to vaccinate our population. Why it quickly came? Because the regulatory regime, because this pandemic nobody has ever seen, and this beast is something different. It works in cold countries, it works in warm countries, it works in super warm countries. It works in every population. No population is spared. And now no age is also spared because it is attacking younger population also. Other diseases are spread when you are in the prodromes or you are infected. Then you spread to others. This particular virus is spread by apparently healthy asymptomatic people, some of whom are super spreaders. And these super spreaders could be identified now with new technologies. So we were a major vaccine producing country. All the regulators around the world decided on regulation, and they created a special regulatory pathway for the COVID-19 vaccine. And essentially everyone used the known platforms. None of the unknown platforms were used. The sequence of the virus was put on, and with the last SARS experience, we knew that spike protein is the binding protein and we need to neutralize it. From the last SARS experience, we had made some vaccines which really didn't go, so we had that experience, and we knew that both neutralizing antibodies as well as the T-cell immunity will be important. So India has become the vaccine hub and was producing some very new vaccine. So our Prime Minister took advantage of this. He visited all the vaccine companies, and he also, our regulators, many people actually abuse them, but I now see the wisdom. Our regulator, some or other, put 2 vaccines out in the market as quickly as possible and started collecting safety data by putting up a AFI surveillance system in place. So this was done very, very quickly. And after that, we had a national effective vaccine management system. We had a cold chain management system, and the supply chain management, etc., were all went like dream. And the vaccine were purchased, pre-orders were given, companies were given money, and vaccines reached their destination. They could be tracked. Every place they could be tracked. The cold chain could be tracked, and whether they reached in a safe condition was tracked. Very cleverly, we put vaccination centers in the healthcare facilities. This was again very clever because, and we also had a smaller supply of vaccines. We somehow or other created the priority list, and priority list was same as other countries, like healthcare workers, frontline workers, those above 60, those above 45, etc. So it was based on who are dying most and who are most vulnerable. So protect them. But now the time has come, because every country now, when this surge came, and surge was inevitable in our country too, because we have not touched the bottom. We were plateau. And wherever it was plateau, it surged again because of the mutants which established globally. Particularly the British mutant we established globally. In India also, in northern India it is there, and double mutant is there in Maharashtra, and little bit of South African mutant also established. So they changed the entire thing, and then there were events around the world. There were elections, there were Kumbh Melas, there were others which were super spreader events. They fanned it out, and we have this surge at this given moment. So now the main aim, as Dr. Arvind Kumar has said, that the vaccine need to go to every arm. And I will give you little statistics. Israel has immunized 118.21%. United Arab Emirates have immunized 90.74%. Chile has immunized 68.76%. United Kingdom today has immunized 65%, Bahrain 55%, United States 54.86%, Serbia about 60%, and Hungary 41%. India has immunized only 5% of its population. And that is why, although we have immunized 114 million, but we are a large country, we are a large population, and we are a diverse and remote population also. So our challenges are different. It is all these countries have put arm in the vaccine of 18 and above.
Seems there's a connection problem at Professor Ganguly's end. While Professor Ganguly is trying to join us back, Ravi, can you please check with Professor Ganguly? May I request
Yes, sir.
Dr. Yeah, thank you, Ravi. May I request Dr. Khilnani to share his thoughts, being a chest specialist as well as a pulmonologist. You have been, I think, thronged with calls like all other doctors, especially in the wake of COVID and now the second wave hitting the roof. What are your thoughts on the vaccinations, the doubts, as well as the measures which are being currently undertaken? And of course, I think the thought which the chamber has also, as PhD chamber has also voiced very clearly, that the vaccination drive should now go to 18 plus age group, rather than restricting it to 45 plus age group, since the new mutant is actually also affecting the younger ones. So over to you, Dr. Khilnani. We are not able to hear you. Ravi, we have to unmute him
Sir,
because
okay, sir.
because it shows muted mic. Can you ask
Yes,
the
sir.
admin?
Yeah, he's unmuted now, sir.
Yeah, please
Yes,
go
Dr.
ahead.
Khilnani. Yeah, now you can go ahead, please. Yeah.
Am I audible now?
Please,
Yes.
you're audible,
Yes,
sir.
please.
Please.
Yeah. So first, I would say thank you very much for having me at this August meeting, and I would report and also respect Dr. Congoley has given the basic.
Dr. Khilnani, your network
uh,
seems to be weak. If you could kindly, try to, maybe, stop your video so that at least the voice could come clearly. Maybe one could try that, yeah?
we know how to treat people.
Your voice is still not clear.
Dr. Khilnani, we are not able to.
you.
Yeah, I think this might be better now. Please go ahead now. Yeah.
So may I request, I'll
There's a
take a
lot
turn
less
a little later. Maybe there's some wrong with my internet. Let me sort it out.
No, Dr. Kilnani, you are audible now. You are clearly
Now it's
audible
clear,
now.
sir. Now it's clear, sir.
So,
Very clear. Please proceed.
what we saw during the first phase of wave that we had as a clinically, first we had a mortality to the tune of 3 to 4%, and then it came down to 1.5%. This was all because of our learning. There's how to use steroids, how to use oxygen, and how to use remdesivir, when to admit patients, when to treat them at home. This second wave has taught me a few things. One, that it is more contagious. I think the incubation period has come down. Only the studies will tell us whether the incubation period has come down. The younger people are getting affected, and there have been definite mortalities also in the younger people. Other thing that I have noticed is that all the patients that we are getting, they are having very high fever. Previously, the fever was there, but not so high. The body aches are very severe. Another thing which I have noticed clinically is that fever goes on for at least 8 to 9 days. As far as the mortality is concerned, initially it was thought that UK strain, which is most prevalent in northern India, 81% in Punjab, it was thought that it is more contagious but does not kill. But the latest write-up in the New England Journal of Medicine, citing 2 studies, have clearly shown that UK strain causes higher mortality as compared to the Wuhan strain, which is called white strain. So we are still learning as far as the management is concerned, but I would like to just cite 2 studies which have come in the Journal of American Medical Association, which has clearly shown that when the 15 states in United States had mandated the mask, the number of cases were less by
Today the electricity condition is very bad. So I'm sorry, I couldn't finish my talk. I will have to go at 5. So, but electricity is very bad. Wind is moving, and I think Dr. Kilnani got cut off also.
Very rarely that happens, but unfortunately today it seems to have been a special
rarely
day.
happens, but today it has happened. I will finish by just filling for Dr. Kilnani with few more words that this Tikakaran program he very cleverly put in, Prime Minister, that we need to ramp up. There was some vaccine hesitancy. He wanted to remove that vaccine hesitancy. And I think he also thinks that everyone should get a shot. So he opened up other vaccines which are being used in regulated world in millions. They should be able to come in India. So that they have done. But few things we need to do now, that we need to really look at our vaccine materials which make vaccine. They come from USA and Europe, and that has been completely cut off. So our vaccine producers do not have the material to produce the vaccine. We need to now concentrate on this, and we need to become self-sufficient into this particular area so that we have these. We also have sequenced 11,000 viruses, but we are not really linked to surveillance and epidemiology. So we need to link with that so that during vaccination, our diagnostic drive enhances and tracking enhances so that we know the hotspot, and there we could perhaps put vaccine in everybody's arm, at least in the 11 state in India. And for doing that, we will need to enhance our infrastructure. In adult immunization, today at 6:45, I will be speaking on adult immunization to FPHI. Adult immunization needs a huge infrastructure, and we do not have that at this given moment. So we had done everything right. I don't think anywhere we have done something wrong. But one more thing we need to do is that we need to create our AFEI surveillance through our country. Most of this is done by the companies in those countries. We need to push our companies to do it, and don't be afraid if there are some AFI which are coming up, particularly the clotting defects which are coming up, and we need to explain it away. We have now a cafeteria of vaccines. We could use the ones which will be more useful, because Zydus will be coming in very soon. Sputnik has come up very soon, and if we know the FAI, we will be able to protect those citizens who might get an adverse event, and we could provide them an alternate vaccine. So this is a very, very important part, and this is something which we need to ramp up. We have a epidemiology we have now a software. We could do this, but our country is illiterate. Even now, when I want to solve something of my computer or my cell phone, I go to my nieces who are young girls. I cannot do that. So so what about the 600 and other people who are very, very poor? They will have a problem. So Dr. Khilani has come back, so I will stop by saying that we have two new products which have been released in Australia and UK yesterday. UK has released Sanitize, which is nitric oxide spray, which reduces the viral load by 90% within 72 hours. And Viralise, which has been released by Australia, again binds this virus. So we have other products which are coming up, which will reduce the spread and which will reduce the viral load in the substance. Thank you for providing me this opportunity. I will beg your leave because I'm very sorry to leave the meeting. Dr. Arvind Kumar, Dr. Subra, Dr. Khilani gave a lot of new information. Thank you.
It was a pleasure in any case having you, Professor Ganguly, with us. I think you have to go, so we'll regret that. But thank you so much. You spared the time, so much time for us. Thank you so much.
Thank you so much, Professor Ganguly. We heard you very highly complimenting the drug department for quickly coming out with the two specific vaccines. And also, I think adding the last bit which you did, that there are changes, there are research, and there are things happening which can also tackle the adverse effects with more vaccines and more variants coming in. So thank you so much, Professor Ganguly. I think it's been a pleasure listening to you and noting all the important points in the research area which you actually mentioned about, which are happening all across the globe. Thank you, Professor Ganguly.
Thank you.
We'll go back to Dr. Khilani. Dr. Khilani, over to you. Sorry for the interruption. I think you had an internet problem.
Yeah, I should apologize for this goof ups, and it's such an important meeting, but it's beyond my control. So I was telling you about the clinical profile that we are seeing, this time. And this is absolutely not unpublished, and this is based on the experience that I'm having, that this particular outbreak, in which I strongly feel is because of the variety of mutants. Some of the mutants we realize, some of the mutants we still don't know. So it is causing one that it is more contagious. I know it's a repetition, very, very contagious. If the one person gets affected, within 2 days, 9 of the family members get affected. Attack rate is extremely high. There is a very high fever which goes on sometimes 10 days, 11 days, and doesn't recede. And the number of admissions are so much people are requiring oxygen, unlike the initial impression from the UK variant that this is a mild disease, more contagious than mild disease. And as I said, there are data that UK variant causes more severe disease and more lethality as compared to the wild strain, that is Wuhan strain. How does it help us? And now I'll give you my take on this subject. The one that RNA virus is notorious for mutations you just cannot stop. Some of the mutations will find into the clinical practice, some will die out. And we are seeing a whole lot of mutations of this particular SARS-2 viruses. We'll have to depend on two things. One will be on our scientists. And it is mandatory that we get variety of vaccine. This Covishield vaccine and Covaxin are very good vaccines, as Dr. Arvind has pointed out, with good efficiency. But Covishield vaccine has no efficiency, no effectiveness against Brazil mutants. What is important is the vaccine, other kind of vaccine, especially the mRNA vaccines, which is actually new technology. And I personally feel that they are superior to as far as the efficacy is concerned, as compared to the Covishield vaccine or Covaxin or Sputnik vaccine. That is one. Second is that this technology has a unique thing that scientists can modulate the vaccine within a period of days to suit the mutations. So therefore, the fight against the coronavirus is going to be for many months or years to come, where we'll have to have the alteration in the vaccines to suit the mutations. So what is the solution? Solution is that Dr. Arvind has said that vaccine should be available to the younger people. I totally agree. But also it is a need of the hour that we should have variety of vaccines in our country. Not only two vaccines, the other vaccines will have to come sooner or later to fight this disease. And of course, as I was talking about the evidence that masks reduce the number of cases by 2 lakhs by mandating the mask in 15 states, reduces the deaths by banning in-house dining in 4 states and Colombia and United States. So therefore, it will have to be multi-pronged approach to fight this wretched disease which has actually changed our life. And I'll just finish by saying that my clinical experience that there are three activities which has caused these cases, because I always take a detailed history and ask them, do you know where did you get it? The most important part, the way the people have acquired is by travel out of the city, their city, and also travel outside India, be it Dubai or some other country, and Dubai being one of the common. Second is marriage parties, and third is private parties, which includes in-house dining. So I think as far as the pharmacotherapy is concerned, besides steroids, none is proved. Remdesivir, I am very fond of remdesivir, but I know that none of the studies have shown that it reduces the mortality. So therefore, we will have to follow the COVID appropriate behavior, whatever vaccine you may get, because the mutations are too fast, too diverse, too difficult to diagnose. And I think that India is not there will be difference between United States and India as far as the investigation is concerned. So we must have our own strategies of minimizing the congregations and changing our lifestyle to fight this disease. Thank you very much.
Thank you so much, Dr. Kilnani. Thank you.
Thank you, Dr. Kilnani. I know there must be some few questions also waiting, but before that, I think it's time for me to call upon Dr. D.C. Katoch, who has joined us from the Ministry of Health and Family Welfare. Thank you very much, Dr. Katoch. It's a pleasure to have you with us. Dr. Katoch is the Chief Medical Officer at the Cghs, which is the prime healthcare taking body of the Government of India. So, if possible, Dr. Katoch, you could switch on your video as well. If we can, then we can continue to interact with you. Over to you, sir.
Mr. Sehgal, thank you very much. I think this my video is blocked from your side, from my side.
Oh,
Admin,
It is
Rathod,
blocked from your.
please check
Okay,
if you
okay,
can-
let's.
I'll just
No,
check,
no, it's
sir.
not possible to on. It's blocked from your side.
I think, sir, yeah, no, it's not blocked from our side. I guess while you were logging in, probably asks you, WebEx has this issue that it asks you at the time of login to switch on the video.
Okay. So no, let me continue as such.
Yeah, if you can find the icon right in the middle of your screen, bottom middle of the screen of video.
Okay. Okay. So first of all, my thanks to PhD Chamber of Commerce for inviting me to this program. And I must congratulate also all the panelists, those who have previously spoken. I think they have elaborated all the aspects of this COVID vaccination. Friends, our country, we are known, we are large. We are large in many aspects. Our country has many large things, large population, large disease burden, large population, large disease burden. Now we are contributing 11% of the world population, and we have the disease burden 21% of the global disease burden. But the important thing which has happened in the last 1 year, more than 1 year, means after this COVID-19 outbreak, means for the global problem, we have harnessed our local technologies. We have harnessed our local technologies, whether with regard to manufacturing of vaccines, the development of vaccines, and manufacturing of the vaccines. And second is also the development of certain guidelines or certain medicinal products from the Ayush side also. Now, if you see virus, I think virus are the particles, I think, came into the universe before the human life. Now, there is no proven medicine for the virus. There is no proven medicine for the virus. Even the virus causes cold, for that also there is no medicine. So we cannot think of any medicine as such for this COVID-19, such a disease. I think the global threat is there for human life due to this disease. Now the problem is this vaccination. If you see, the vaccination is not meant for preventing the infection. Is not meant for preventing the infection. It is meant for preventing the outcome of the infection. And so that is we must be aware of this fact. That the people think that if you are vaccinated, if you have taken the vaccine, it means you will not get infected. No, it is not like that. It is not like that. So infection cannot be prevented. Infection means mere entry of the virus into the human body. So that will happen, and this infection, this viral virus, very virulent, and means now the incidence of viral infection that is also increasing day by day, particularly in the second wave. Now, in the last just 1.5 months, I think now we have crossed more than 1 lakh, 2 lakh cases per day. So that is I think vaccination. And I must congratulate our entrepreneurs, our regulators, and our manufacturing units, those who have produced these two vaccines. I think these two vaccines, the local vaccines, and which are going globally also, and the production needs to be augmented. More and more people needs to be covered with vaccination. I think now the government is, I'm worried about the manufacturing quantum of the medicines. Many state governments, they are saying that the supply of medicines, supply of vaccines, that is not adequate. They have less supply. So in enhance coverage of vaccination, the production as well as distribution, that has to be augmented. That has to be augmented. But there is other aspect also, that since I am working in the Cghs and I am also attending patients, we have seen that the patients, those who have taken vaccine, definitely certain side effects they suffer from. Like it could be stiffness, it could be body pains, some allergic reactions, some loss of appetite, bleeding for 4, 5 days. So instead of going to the allopathic side, they usually come to the Ayurveda side. And even for the prophylaxis purpose, means before going for the vaccination, these people, they are coming to the Ayurveda side. Today also, today in the morning, I think 7 such patients, those who are going to be vaccinated or those who have taken a vaccine in the last 2-3 days, they came to us, they came to our dispensary and they wanted Ayurveda medicines. So we prescribe them Ayurveda medicines because to enhance the immunity, to promote the health index, I think there are better solutions from Ayurveda side. So when the government through the Ministry of Health and Family Welfare and from the Ministry of Ayush, this healthcare approaches of both the systems, these are being promoted. I think along with the vaccination, which is essential, means vaccination has to be done. The whole population has to be covered. Means those who are eligible for vaccination, those have to be covered. But apart from that, I think the people, they must be aware of, they need to be made aware of that there are certain options, there are certain solutions available from the Ayush side, which can help in the prophylaxis as well as for the management of the infections and the post-COVID illness, for the rehabilitation and for the restoration of the health. For that, the Ayush options are available. So with these words, I thank again the PhD Chamber of Commerce for inviting me to this program, and congratulations to all those who are involved in taking this program ahead. Thank you.
Thank you, Dr. Katoch, for your thoughts. I know you've been at the helm of the drug control at the Ayush Ministry and contributed tremendously to the entire enhancement program so far as the immunity is concerned, through the approval of the Cghs and also making many more such products available in the market through the drug control department of the Ayush Ministry. And today, I think we've discussed it at many forums, and I'm sure Professor Arvind and Dr. Khilnani will agree with me as much as Dr. Subramanian that the immunity boosting has been tremendously taken care of by a lot of our traditional medicines, which has been also acknowledged the world over. And that is also, I think, one of the reasons, I don't know whether I can say this, we are not in a bad situation or as bad in a situation as we could have been. With that, I'd just like to come to a few quick questions, because I know, as I said, the time of the doctors is very, very precious. So my first question to Dr. Khilnani is that you talked about, various, changes which have to be kept on, which have to be kept in mind, which will be made in the vaccine as the mutant changes the mutant changes come to the virus. So my question is that what will happen to the vaccinations which have been done, before these changes are made in the vaccinations? Will it require extra dosages to people, or how would that happen, sir? Can't hear you, Dr. Khilnani.
100%. And now you can hear me, I guess.
Yes, yes, now we can
Yes.
hear you.
So we have to go to the example of influenza vaccine. We know that we change it every 6 months. North sphere vaccine, southern sphere vaccine, and that principle is same. Because the influenza virus also keeps mutating. So scientists make vaccine every 6 months and grant it to the. But influenza is not in pandemic currently. Now this is a pandemic. So this is a big question in the international community as to how frequently vaccine will need to be repeated. And as I said in my remarks that I think this fight with the COVID is not stopping in 1 year. It may go on for 2 years, 3 years, 4 years. No one knows. So this vaccine will have to be altered periodically, maybe every 6 months and 1 year. Other thing is that no one should go with the idea that once he is vaccinated for life. We do not know
Right.
the duration of immunity with the vaccine. We also do not know the immunity which you acquire by getting COVID infection. So therefore, when I said alteration in the vaccine, I was citing some of the top virologists and our knowledge about the influenza vaccine, which is altered every 6 months. So since the mutations are so common and so frequent and so dangerous and so ominous, so I strongly feel that vaccine will have to be altered periodically to fight this disease. That was the idea. Thank you.
Thank you, sir. Sir, I would also like to ask a question. My query would be, you see, we've been hearing very recently now about a cocktail of vaccines being found to be quite efficacious and probably, something that might succeed even better than one single vaccine, in the sense that it would carry the strengths of more than one vaccine if you, as you add the vaccines. So, as a concept, would it be something that could be tried in our country also, that if you have had a vaccine A, then the second vaccine could be a jab of vaccine B? Could that be one of the options, or would a mix of various vaccines have to be prepared, or a cocktail as it is called, be prepared in a lab or by a pharma manufacturing company?
That would have to go to the scrutiny. Whatever vaccine you make, if you are thinking of cocktail of vaccine, it cannot be granted in few months' time. It is going to take at least 1 year for that to undergo so many studies. It cannot be as easy as you think. But the thing is that we should have, like, so far till now 13 vaccines have been provided authorization. And we must understand that none of the vaccine has got proper authorization. These are all emergency authorization because of the pandemic situation. Normally, it takes 8 to 10 years for a vaccine to be developed historically. So therefore, there's a question that I have received Covishield vaccine, for example, and I have not got formed antibodies, or I am not protected, or whatever. Now, should I get Sputnik vaccine, or should I get a messenger mRNA vaccine? Those questions are not scientifically answered. And the other thing is that it also depends upon the scientific studies. And as I said, that Oxford vaccine has almost zero efficacy against Brazilian mutant. So this will all depend upon the basic scientist study as to what kind of mutations come, which vaccines are effective against. So far, what my knowledge goes, that majority of mutants are amenable to protection by vaccines. Now, if the Wuhan, as I call wild strain, has got 70% efficacy with the vaccine, Covishield vaccine, the UK vaccine is also, UK mutant also gets protected by Covishield vaccine. So this will all depend upon laboratory studies as to which vaccine is effective and how. That's why I said mRNA is a technology which can be altered, and scientists, as I understand, have the capacity to alter it within a period of days and grant you a vaccine which will be effective against particular mutants. But there's a long way to go. That's why I'm emphasizing and giving you citing examples for preventing the transmission, because I've been studying this subject for last 1 year very vehemently, and I personally feel, and I kept on saying on television that we are sitting on a time bomb, and that this is actually documented. And I still feel that although the world has got vaccination, although the Israel has vaccinated more than 90% people, UK has vaccinated 70% of their adults, but it is still a long way to go because of the mutants are creating tremendous amount of trouble. So scientific studies will have to be continued, new vaccines will have to be formed. There are 160, 170 candidate vaccines are in progress of making. And this is going to be continuous process. So the bottom line is the community health studies and community health preventive strategies, which will protect us. Vaccines will supplement it. Thank you.
Thank you, sir.
Dr. Khilani, just one point. I think regarding this, the COVID vaccine cocktail, there would be issues of vaccine interaction also. Vaccine to vaccine
Yes.
interaction as well as the safety.
Yes.
That
So,
would be important.
I
That would
don't
also
think
be a
it is.
concern, I agree.
I don't think it is coming soon enough. You can't. You can have a cocktail drink, but you can't have cocktail vaccine without testing. So that's as simple as that. And testing
safety will-
takes months to years.
Safety will be a big issue.
Yeah, sure.
Hello.
So, Dr. Kulani,
Sure.
I was also getting some questions related to testing. You know, there is a crisis out there in even places like Delhi, the capital region, that
Yeah.
testing kits are not available. Even rapid testing kits are not available.
रीसेट हो
So
जाएगा
would you-
फिर तो उनका हर सब्जेक्ट
So the question is that under
एक बार
what
सुमित से
conditions
पूछो,
should the
सुमित के
testing
पास
be done so
सुनने
that
पाए
more care can be
Sorry,
reduced?
sorry, there is a voice. Some voice is coming. I'm not able to follow you.
Yeah, Ravi, can you? Okay, I
कब तक
think it
गई
was from.
Sir,
Hello?
please, last two sentences I didn't follow.
Right. So the question
वैसे
is
कर
that
ठीक है अब अगर ये वेबिनार चल रहा है खत्म
hey,
होता है तो अभी दे
Ravi, can you tell Paramjeet to
Text
please
कर
put
दो।
himself on mute?
Yes, sir.
Sorry, Dr. Khilani, for
No,
this.
no problem.
The question was that under what conditions the testing should be done, because a lot of people are rushing for testing when they are not even really having ample, let us say, symptoms of fever, but still a small loose stomach or a little bit of cough, going in for rapid test. And then after the rapid test coming out to be negative, then they're rushing for the RT-PCRs. So what are the basic protocols which an individual back at home should follow for testing?
So, sir, it is very easy to criticize people's behavior, but I'll give you a rationale. 60% of the transmission all over the world is by asymptomatic people or mildly symptomatic people. So, it is very important to identify people who have. So that is one thing. Second is the sensitivity of a test. This rapid antigen test has a sensitivity of at best of 50%. The RT-PCR has a sensitivity of 70 to 80%. Thankfully, the specificity of both tests is good. So, in my opinion, whosoever has got sore throat, whosoever got mild fever, or he is having body aches or unusual cough or unusual running nose, or he has been in contact with any patient, he should be tested. Now the facilities are limited. Who should not be tested, in my mind, and I would be very candid and unconventional. Suppose there is a family of 6 people, and one person has been tested positive, and if the rest of the 4 people have developed fever and the similar symptom, now please don't quote me. My license can be cancelled. But if in practice, I tell them you may not test. if you want to save the trouble. Because in heart of heart, I know that these people have COVID. But somebody who has been in contact with a COVID patient or has even diarrhea or even have a loss of appetite or he has got a uh, slightest amount of body ache or fever, depending upon his clinical state and where does he live in today's situation. This will, 2 months back, I wouldn't have given this statement. In today's situation, there should be very, very low threshold for testing. Unless we test, we will not find. If we don't find, we transmit. And as I said, that this particular strain, whatever is going around, is estimated to have a R factor of 5 to 6 instead of 1 to 2. So the contagiousness is very high. So if you leave one person undiagnosed for a period of 3 days, you are causing further disaster. So that's my answer to your question.
Okay. So thank you, Dr. Khilnani. I think that clarifies quite a few things. And does it, just a related question to that, that in case the symptoms are dying out in the next 1 or 2 days, does it mean that the further testing is not required?
No, not at all. Not at all. I will also go one step ahead. Who should be retested? If somebody has had a definite contact with a COVID patient, and if he has symptoms, if he is tested negative, then he must be retested. As I said, since the sensitivity of a test is at best 70%. It depends upon how, those of you who have got a nasal swab or nasopharyngeal swab, it's quite irritating to get it done. You know, they put the swab right into the, through your nose and go back. Some people may not go deep enough. So therefore the sensitivity is only 70%. And also sensitivity vary from at the time that you take. Sensitivity is maximum 1 day before the symptoms develop and up to 3 days after the symptoms develop. After that, the chances of positivity go down. So therefore, if the patient has a contact, has symptoms, has been tested negative, and if you don't find any other cause for fever, I'll add to that as a clinician, he must be retested at least once. We take 2 negative as true negative. I hope I'm making myself clear. We take in this particular 2 negative as true negative, 1 positive is taken 100% positive. Thank you.
Thank you, Dr. Khilnani. I've been getting a lot of calls for even arranging kits or even arranging people to visit homes, for testing. So quite a situation today back in Delhi. So therefore, I thought it's important to.
No, your point is very valid. Your point is valid. Today we don't have remdesivir, It does not mean that I start recommending the remdesivir should not be used. Of course it should be used. So similarly, the test, the way the escalation has occurred, the test, there is a shortage of tests, but as a clinician, I should say what is correct. The correct thing is the test should be done. So the arrangement should be made to procure it.
So thank you very much, sir, for your kind words and time.
My apologies for goof up.
No,
No,
not at all, sir. I
absolutely.
think it's absolutely fine. It's
Not an issue at all, sir.
Absolutely.
Thank you so much. So I'll take your leave, and I'm honored to be in this August group, and anytime.
Sir, before you do leave, and before Dr. Katur leaves, we'll have a vote of thanks from Professor Arvind Kumar, who's our co-chair of the committee, and a summing up.
Thank you so much. Thank you so much. I think, we are very blessed today to, hear all of you. And one of the lessons is that we are not going to be a COVID zero, and it's going to be, season after season. So the key take is that, to tame it and control the damage. And I think, one of the things which has been very well said by our experts today is that there are a lot of vaccines which has been available, and we must congratulate our the government and also the DCGI, for approving the number of such vaccines. Like today, if we talk about, about the vaccines, if we have to go through a full process,
your voice
as
is a bit low,
Dr.
though,
Kinani
Professor.
also mentioned.
Could you increase your volume if possible?
Yeah, because there is some issues. Is it better now?
Yeah.
Yeah.
Right. Right. So I said that, when we talk about vaccines, there is, if you have to go through a process, me being into a pharma industry, you have to look into a pharma quality, non-clinical, clinical trials, 1, 2, 3, and then, evaluation and decisions, and the safety monitor. So it is a long process. But I think, in this emergency, India being now a vaccine hub has taken a very wise decisions, and very well pointed out by uh, Professor Ganguly, is about the adult vaccinations. We have a vaccines today, but infrastructure and surveillance is one thing. Probably, we have to still work on, and we have currently 3 vaccines, yeah, Covishield, Covaxin, and also Sputnik, which has been approved by the DCGI, and very soon we'll have this Zydex also. So it's a race between the variants and the vaccines. But the good news is that we have a choice, that we could still use it. But there are always remain to be hiccups in production, and there is hiccups which is in safety, which is inevitable. So but we need to work. So on behalf of PhD CCI, I would really like to extend my sincere thanks to our keynote speakers, Dr. DC Katoch, Chief Medical Officer, Cghs, Ministry of Health and Family Welfare, and Professor N.K. Ganguly, former Director General, ICMR, since sir is not here at this moment, but I've been closely working with him, so I know that he's always a source of inspirations. Even at this age, like he points out very the issues. Very nicely, from the use of masks to the use of the surveillance and infrastructure, which is the key for today. First of all, I would also like to thank our president, PhD Chamber, Mr. Sanjay Agarwal, for his the welcome remarks and sharing the insights on the importance of vaccinations. I would extend my thanks to Dr. G.C. Khilani, Vice Chairman, PSRI, Institute of Pulmonary, Critical Care and Sleep Medicine, and Professor Dr. Arvind Kumar, Chairman with the Medanta Hospital, and our own Dr. Subramanian, who is the Chair of Health Committee, PhD Chamber and Director Medical Services, Indraprastha Apollo Hospital, for the valuable suggestions and the guidance. And also the today's session moderator, Mr. Vivek Sehgal, and Ravi, who has put the speakers for the today's seminar. Although today we are talking about that the importance of the Tika, and there was a kind of a seminar where is kinds of a survey which has been done, that the people were not ready to take the vaccinations. But today I think we are not in this stage. We have seen that there is enough acceptance. Although earlier there was, when the survey was done in June 2020, there were 71.5% of people who were reluctant to take the COVID-19 vaccines. But I think we have come so far where there is people who is looking for and demanding that what kind of a variant they can have it, whether they want to go for Covishield or a Covaxin, or some others. There is a lot of awareness which has happened through the government, through the public health, some of the committees, some of the public health forums, where we think that to overcome the pandemic and to return to a normal life, we don't have any choice. The choice is that we need to have a kind of a vaccinations. But as I mentioned, that this is the COVID zero is going to take some time, so we have to work with the best of the ability, and with all the resources which has been available to us. So with these words, I would like to once thanks one and all for joining in today, and hope that everyone remains safe and healthy, and we come out victoriously in the fight against this pandemic. Thank you so much.
Thank you. Thank you. Thank you.
Thank you. Thank you, Madam Cook, for that hearty vote of thanks and well deserved to our eminent speakers who spent the valuable time with us today, despite their busy schedules. My thanks goes out to Dr. Ravi Rathod and Mr. Amit Patwal working on the back end to make all this happen, and of course, our IT team, who's been always a great support. And I thank our Secretary General for continuously inspiring us these kind of programs and events. Thank you very much, one and all, and have a good evening ahead, and please stay safe, and especially the doctors need to stay safer so that they can keep a lot of us safe.
Rest of us safe. Rest of us will be safe only when the doctors are safe.
Thank you. Thank you very much.
Yeah, great. Thank you. Thank you. Nice.
Thank you, sir.